Today, today we are going to see the first 50 questions answer in UPSC CMS 2024. First question: consider the following finding in the urine examination of suspected hematuria. In hematuria, the urine microscopy finding is red cell cast BE, and it is due to the glomerular bleeding. BEG is the correct answer. BFG is the correct answer. Option A is correct answer. Second question. Second question is about the anti-glomerular basement disease. It is a rare autoimmune disease which presents as a rapidly progressive glomerulonephritis. It is correct. Antibodies are formed against alpha 3 type 4 collagen. It is correct. Alpha 3 expressed in basement membrane of glomerulus and the retina. It is not in the retina, it is in the lungs. Okay, so it leads to the lung hemorrhage, not retinal hemorrhage. Option 1 2 is correct. Poor prognostic indicators of glomerular diseases. Male sex, not the female sex. Hypertension is a poor prognostic factor. Persistent severe proteinuria is poor prognostic factor. Elevated creatinine is a poor prognostic factor. So 2 3 4, option C is the correct answer. Which of the following indication for renal biopsy? The indication for renal biopsy is acute or chronic kidney disease is uncertain etiology. Is nephritic syndrome. Nephritic syndrome is there. An uncontrolled severe hypertension. Renal transplant dysfunction is also there. Uncontrolled severe hypertension is not the indications for renal biopsy. Fifth question. Stage 2 CKD. Stage 1 CKD is glomerular filtration rate is more than 90. Grade 2 60 to 90. Grade 3 30 to 60. Stage 4 15 to 30. Stage 5 less than 15. So the answer is stage 2 CKD. Stage 2 CKD is 60 to 90. So 60 to 80. Diagnosis of PCOS syndrome requires the presence of which of the following? Menstrual irregularity is there in the PCOD. Clinical or biochemical androgen excess is there. Multiple cysts in the ovaries is also PCOD. BMI less than 18.5 kg is not a criteria for PCOD. Young male presented with the recent onset of urethral discharge and dysuria. On examination, the discharge was profuse and purulent. Microscopy of smears from the discharge revealed the gram-negative diplococci. What is the diagnosis? Gram-negative diplococci. Genital herpes is a virus, so it is not the answer. Chlamydia and syphilis is not a cocci, so this is also not the answer. Gonorrhea is a gram-negative diplococci, so it is the answer. And this is called gonococci, gonococcal urethritis. Okay, the nephritic range of proteinuria and have the low serum complement level in all the diseases. SLE, post-infectious glomerulonephritis, infective endocarditis, mesangiocapillary glomerulonephritis, lupus nephritis, and all the diseases have a low serum complement levels. Clinical features of Parkinson's disease. Hypomia means expressionless face. Dysphonia means soft speech. Fascination gait, gargle, rigidity. These all are the clinical features of Parkinson's disease. Okay, lesion in the extrapyramidal system present in clinical. Okay, in lesion in extrapyramidal system that leads to the tremors and rigidity. Transient global amnesia. Middle-aged Middle age, abruptly discrete antagonism lasting with few hours. This is the disease. During this episode, the patient unable to record new memories, resulting in repetitive questions. Is also there. Consciousness is impaired during the in transient global amnesia. Consciousness is preserved. So 3 is not in the option. So the answer 1, 2, 4. Contralateral homonymous lower quadrant anemia is a type of visual loss when the lesion is located which one of the following anatomical location. Okay. Lower quadrant anemia means in parietal lobe lesion that leads to the lower quadrant anemia. In temporal lobe lesion that leads to the upper quadrant anemia. So the answer is parietal lobe. Height of jugular venous pulse is determined by right atrial pressure. Ascending location in the superior vena cava and right atrium. High output, very severe anemia and thyroidoxicosis. All of the diseases have a high cardiac output failure. The reverse splitting of S2 is most commonly seen in the left bundle bunch black. Polyarthritis is a criteria for, major criteria for Jones, not polyarthralgia. Okay, 18th question. A 70-year-old man with dyspnea and exertion are found to have a single second axon, single S2, diamond shaped rough quality systolic murmur and second intercostal space radiating to carotids. This is a feature of aortic stenosis murmur. Okay, risk of stroke in patients of non-valvular chronic atrial fibrillation and oral aneurysm. As-blood is this is for bleeding risk chart 2 DS2 VAS2. This is a risk of stroke in patient with chronic atrial fibrillation. Okay, consider the following statement regarding the pulmonary embolism. Unexplained breathlessness is the most common symptom. Correct. In congestive heart failure or pneumonia fail to improve despite standard medical treatment, occult pulmonary embolism should be occurred. Correct. Patient with a high clinical likelihood of venous thromboembolism should first go for D-dimer testing alone without obligating. This is not. Patient with high clinical likelihood of venous thromboembolism, we directly go for CT pulmonary angiogram. This is light criteria. Correct. Clubbing usually affect in the fingers symmetrically. Clubbing involves the toes but not symmetrically. So option 1, 3, 4 is the correct answer. Lofgren syndrome also seen in the males because it is an autoimmune disease. So it is seen in females associated with sarcoidosis characterized by peripheral arthropathy and uveitis. The clinical features include all. Tuberculosis. In tuberculosis, nucleic acid amplification. We go for nucleic acid amplification. Culture in the middle. Nucleic acid amplification. Culture in the Middlebrook medium. Peripheral blood smear also there. But light emitting diode fluorescent microscopy is not in the TB. So option 1, 2, 4. Which of the following correctly describe the primary position of the right eye in right cranial nerve palsy? In right third cranial nerve palsy that leads to the LR6 S44. So third rest of all muscles. So So all the muscles affected, only LR6 and SO4 muscle activated. That's why the eyes goes downwards and medial, downwards and outwards. Remaining 25 questions we go for next session.